Examiner is not even asking what is the enzyme in Niemann-Pick. Niemann-Pick is lipid disorder. Happy. So first question देखते ही आपको मालूम होना है बायोकेमिस्ट्री इजी हो रहा है या टफ हो रहा है, समझ में आ जाना. वो you first question only you must test the waters, you will be knowing. So that's what I am saying. Hypoglycemia in children is defined as less than 50. Sir, illogical. Our MBBS students don't know 30 or 50 or 80, all are looking normal range of, low range of glucose only, right? Apnea of prematurity does not alter the prognosis unless it is all of the above. Unless it is all of the above. Unless it is severe, it is recurrent refractory therapy. English. If it is refractory therapy, obviously poor prognosis. If it is recurrent, poor prognosis. Severe, poor prognosis. Then, hyaline membrane disease may, all of the above. That is, 60 to 80% of infants below 28 weeks of gestation, and RDS increases in those who are, when the mother is having diabetes. Why maternal diabetes will lead to fetal RDS? Batao, fatafat. Maternal diabetes will lead to fetal hyperglycemia. Fetal hyperglycemia stimulates fetal hyperinsulinemia. Insulin is an inhibitor of the surfactant production. In a newborn with scaphoid abdomen means congenital diaphragmatic hernia. Beautiful question, doctor. I had been waiting for this question long time. Breast fed jaundice, breast milk jaundice. बोल के दो entities है. Let's talk about them. Breastfeeding jaundice versus first one is what? Let's read this. Breastfeeding या breast. This is breast. Oh my God. Breastfeeding. Okay. First is breastfeeding jaundice. Second is called as breast milk jaundice. Breastfeeding होता है third to fourth day of life. Decreased milk intake will cause increased enterohepatic circulation of the bilirubin, and that lead to jaundice. And you need to give fluid and caloric supplementation. Those who go to starvation, they get jaundice, no? That is similar to that of the breastfeeding jaundice. Feeding and starvation you will easily remember. Starved people also, adults also will get jaundice if you starve somebody. Why it will happen? If you starve somebody, it will increase the enterohepatic circulation of the bilirubin, and that lead to development of jaundice. So treatment is treat their starvation by giving fluids and caloric supplementation. Whereas breast milk jaundice, it is late to start on day 4. It will reach 20 to 30 on day 14, and it will reach normal value 4 to 12. Lot of times breast milk jaundice is identified as a prolonged physiological jaundice. It is because of the beta glucuronidase in the breast milk, which is responsible for increased enterohepatic circulation, is responsible. So how can you treat it? Stop the breastfeeding. If the jaundice due to breastfeeding in a breastfed baby is starting on reaching a peak on day 14, okay? So these differences closely remember, doctor, once more aayega, right? GVHT, graft versus host disease. It is a major cause in case of allogenic hematopoietic stem cell transplantation like bone marrow transplantation. Everyone knows this. But remember, doctor, after going home only, GVHD, post-transplant, early infections, late infections, right? And different types of transplant rejection, different immunosuppressives used in transplantation. एक बार पक्का पढ़ना, क्योंकि ट्रांसप्लांटेशन इज इन द हिट लिस्ट ऑफ एग्जामिनर. वीआईपी हिट लिस्ट रहता है ना टेररिस्ट के लिए. They want to hit some topics. That is this transplantation topic, and you're all tomorrow's top transplant surgeons. One day when I come, I will find DM nephrology, returned from some London degree, London or fellowship in America, and then you are practicing a big time what you call nephrologist. That is my dream for all of you. Now doctor, childhood asthma. There are more than 100 genetic loci. Common sense wala question, purely general GK. Remaining all you should basically eliminate it by common sense. SLE can present with all these things: seizure, serositis, thrombocytopenia. HS purpura, most common vasculitis, IgA, nephropathy, etc., etc. Rheumatic fever criteria: chorea is there, arthralgia and fever is there, elevated streptococcal antibody. They are all true. Acute epiglottitis is what? Haemophilus influenza. Enteric fever is typhoid. At least this you must answer. Then measles, you must know the incubation period at least for measles. So incubation period is 7 to 18 days before the rash, and prodrome of about 4 days, and rash is for 4 to 8 days. That is the typical timetable of measles. Herpes zoster. It is uncommon in child. When the people become immunocompromised, they get, if they have chicken pox in the childhood, and zoster is not caused by exposure to a patient of varicella. It is not the herpes coming from external thing. It is a herpes internally which got reactivated will lead to zoster. Then permanent dentition of children, doctor. एक dentition वाला question. ये wrong करे तो that shows that you are unprepared student for entrance. How many answered wrong? Dentition you should not do wrong. आज seriously think करना. Where is my life going? In what direction? Because dentition, primary, permanent, वो standard question है. So doctor, I leave the literature of the timetable of dentition. I too used to never like during my preparation this kind of muggable, compulsory, unpalatable questions. But still what we will do? Intussusception. Vomiting occurs, abdominal pain with screaming will be there, and lot of times cause will not be found because there are various causes starting from intussusception, I mean a polyp to so many causes are there. How many answered this wrong? ORS, doctor. Health minister will be unhappy if MBBS doctors don't know ORS. At least that is what he is expecting before giving MD seat. Once more, muggable question. Sodium is 2.6, potassium chloride is 1.5. You should also remember gram per liter and millimoles per liter. Once more, you should also know the composition of the rhizomal, low osmolarity ORS. Now, children with chronic tonsillitis will have halitosis, bad breath. So, what is the most common cause, madam, for pharyngotonsillitis? Is it staph or step? So, throat is step only, no? Bronchiolitis, respiratory syncytial virus is responsible. This is a little common sense wala question. Should have some background knowledge for this. Neocerebellar lesion. Hypotonia classically occur in the only in case of neocerebellar lesions. So what is archicerebellum? Posterior lobe is archicerebellum. इसमें flocculo-nodular lobe, fastigial nucleus will be there, and it is concerned with equilibrium. Paleo-cerebellum, spinal cord जो भी cerebellum से connect होता है, that is paleo, and you have paravermis, globose and emboliform nuclei in that, and it sends to red nucleus. Cerebello, rubro, thalamo, cortico pathway is there, no? Dentato, rubro, thalamo, cortico pathway. So that is basically paleo. Neo is that cerebral hemispheric part, and that is important for tone. Speech function of cerebellum is altered whenever left hemisphere is affected. That's what I too wondered. Cerebral or cerebellar is the question. But he was giving vermis and archicerebellum in that, no? No, there is a cerebellar, whenever cerebellum get affected, you get a scanning speech. Scanning type of speech it is called, scanning speech. Scan, जो दारू पीते हो बात करते ना? Why? Because daru will have effect on the cerebellum. Cerebellum, that lead to, that's the reason they have that, hey Paru मैं आ गया. So that scanning speech is what Devdas will tell to Paru is due to the cerebellar dysfunction. But that is left hemispheric, I just need to reconfirm. I don't know this funda. Intentional tremor is basically because of the cerebellar dysfunction, and dentate nucleus is the one which is predominantly involved. In pregnancy, systemic vascular resistance decreases typically in the second trimester, where the level of the progesterone reaches critical level with vasodilation. Preeclampsia में किसको निकालना? बहुत fetus placenta को निकाल के फेंक दिए तो बीपी कम होता, कुछ भी करे तो कुछ भी नहीं होता. Then substernal discomfort in ischemic heart disease. Beautiful question, doctor. This is. How many answered left arm? Aha. Kush hua mogambo. Huh? This used to be our chief's favorite question. Hey man, right side or left side, where is the pain? He used to ask. He's a Assamese guy. Very stylish way of asking. Assamese style of English. Hey guys, you should come in t-shirts, not that formal aprons too on Sunday. It used to be like working under a British medical teacher, kind of a this thing. He used to say, agar if you say left no, oh, he's kush. Join a nice party in the evening, I will tell you, which side some funda, he used to say, favorite question. So if you look at the predictability of MI, radiation of the right arm or shoulder is 4.7 predictability for MI. Traditionally we remember left side jaw, blah blah blah, ulnar border, etc. That can even be due to cervical spine. Radiation to both arms has 4.1, with exertion is 2.4, radiation to left arm is 2.3. So radiation to right arm has the highest predictability that this is a MI wala pain. Okay? So be very sure, doctor. If your right arm pained but still you didn't come to hospital, you have left the world already. So that is the famous saying. Huh? C56, what is the reflex? C56. Doctor, one question definitely they will ask tomorrow's exam. So if you look at the various neurological levels, deltoid biceps is C5. I mean the muscle. And what is the sensory distribution? Similarly, C6, how will you test? You have got the supinator jerk for the C6. Then C7 you will check the triceps jerk. Then C8 basically there is no reflex related to that. So C5 is biceps, C6 is supinator, C7 is triceps. So be sure. Fever is which? Interleukin 1 beta. I gave you the high topic list now. Pathology में top 10 topics जाके देखो एक बार, interleukins and inflammation रहता. 1 IL, 2 IL questions आ गया. एक psoriasis में interleukin 17 is illogical, but this is logical and total logical. So anakinra is IL-1 receptor antagonist. Then orthostatic hypotension, when do you call? Typically whenever 10 millimeter mercury reduction is there in the diastolic pressure within 3 minutes after standing. This is one of the traditional ward round question. How will you test a orthostatic hypotension in a diabetic autonomic neuropathy? As a MD general medicine, if you fail to answer 10 or 15? Recheck. MD general medicine will be in stake final year. Paratonia, Gegenhalten is due to frontal lobe. Fasciculation is lower motor neuron. Episodic general weakness is not a feature of Lachner infarct. Lachner infarct bole to permanent infarct. Permanently only your hand is paralyzed. It is not transient weakness. Rasmussen aneurysm is lung mein. Whenever tuberculosis is there, the cavity will contain that bleeding vessel. This is a high level question. So high level intelligence rahna. So it looks simple. Ampule of 10 ml, 10% W by V calcium gluconate has got 4.5 milliequivalents of calcium or 2.26 millimoles of calcium, which is equal to 90 milligrams of calcium gluconate. Tough question, illogical. They can put the option as renal tubular acidosis, no? Which is normal anion gap, so reasonable high. Respiratory acidosis already. It is not high anion gap. All the remaining are all high anion gap. Most common disorder, vitiligo, Edison disease, then hypothyroidism, all will coexist together. Pinch purpura, it looks like you have pinched amyloidosis. The necrobiosis lipoidica is not a pre-malignant condition but found in diabetes. Purple colored plaques are typically that fleshy lesions are all Kaposi. Dole bodies are typically seen in case of infections and toxic states. But our ABPG guy will give real Dole body and ask where do you find them tomorrow in the state entrance. Tardive dyskinesia, oh, illogical mein dalo yaar, jaldi dalo. Chalo, what is the different, yesterday only I came to know that the acute drug reactions are divided into type A, B, C, D. This hypersensitivity is not your type 1, 2, 3, 4 hypersensitivity. आप भी वही सोचा ना? हाँ? सोच के क्या आंसर किया? C करके आंसर किया. इसलिए अड्डी वारी गुड्डी दबा बोलते. There is a different acute drug reactions, doctor, are divided based on the type of reaction into type A, B, C, D, E, F, G, H, U. Okay. A is augmented, B is bizarre, C is chemical, D is delayed, E is exit, F is familial, G is genotoxic, H is hypersensitivity and U is unclassified. A augmented reactions which can be predicted from a known pharmacology of a drug which are dose dependent are called as type A. अगर एंटीकोगुलेंट दिए तो ज्यादा दिए तो ब्लीडिंग होता, ये तो एक्सपेक्टेड है, इसलिए ज्यादा दे दो और ब्लीडिंग आने दो. दैट इज कॉल्ड ऑगमेंटेड टाइप ए. टाइप बी बिजार, यू कैन नॉट प्रेडिक्ट इट. इट इज नॉट डोज डिपेंडेंट. पेंसिलिन किसको एनाफिलैक्सिस आएगा मालूम नहीं आपको, आपके किस्मत पेशेंट के किस्मत के ऊपर होता है. Then type C are chemical, biological characteristics that can be predicted based on the chemical structure of the drug, like paracetamol, right, and hepatotoxicity. So in this case, what is that? You are using phenothiazine. Phenothiazine is what? Acting on dopamine receptors. Since it is acting on dopamine receptors, it is leading to dyskinesia. So this reaction is because of the particular chemical structure and the mechanism of action of the drug, hence called type C. Okay. तो एक बार पढ़ के जाना, क्योंकि एग्जामिनर्स each of them you try to review. Sorry, we didn't give you this explanatory booklet, but please collect it. We will upload it as a PDF and a blog in newsformedico.com. Just review these reactions. E is end of the treatment reaction. Typically, drug after withdrawal, when the drug is stopped abruptly, they will happen. They are called as type E. Type A? Type A bizarre. D is you have seen it very clearly. So answer should be D then. Yeah, diya na? But we can also ration it as C. C means what? Based on the mechanism and chemical structure of the drug, you are predicting a particular drug reaction, that is C. The word tardive dyskinesia makes it. Was it tardive dyskinesia given? Oh, then it should be D. Answer should be changed. Already वो अंधेरी में क्वेश्चन है, हम अंधे हैं. तो two things are preventing us to see the correct answer. So okay, good point you mentioned. One big clap. That's good. Nitrate tolerance. How can you prevent the tolerance with nitrate? You change the dosage twice daily between 8 AM and 3 PM. If you do that, then you can prevent the eccentric dosage schedules. If you give, then tolerance can be prevented, right? So if your face is too used for your spouse, सुबह से शाम को चेहरे देख के मोहब्बत कहाँ रहेगा? Suddenly you want a surprise, you take a break at afternoon 1 o'clock and then book a nice lunch with a nice red wine on the pool side and take her. That is a little suddenly there is a new shape and form of you will come up. So that way nitrate भी जो regularly लेता है उसका effect चले निकल जाता, unless you start some eccentric trials, but don't be too eccentric, you may end up in divorce. So teratogenicity due to drugs like cytotoxic drugs, ACE inhibitors, is highly risky. Obviously when you take it in a teratogenic period of embryogenesis, that is between 2nd and 8th week. Meiosis occur in all these scenarios. Consanguinity, especially autosomal recessive disorders में मामा को बेटी को शादी करे तो the consanguinity is more often seen in autosomal recessive disorders. X-linked inheritance, same question they asked, once more 25%. Huntington's chorea is basically trinucleotide repeat. ABO transfusion, this is correct. This is hypersensitivity wala question, type 2. Serum sickness is type 3. Matlab they picked up all 4-5 questions, suddenly walked out of the question bank. So they are supposed to ask one question each year. So acute cellular event is basically transplant rejection, delayed hypersensitivity or immune complex. Hyperacute is preformed antibodies, which are like type 3. Preformed antibodies against fixed tissue, na? So type 2. So this is delayed, that is lymphocyte mediated reaction, T lymphocyte mediated, cell mediated immunity. Acute. Type? In the drug reactions, in the transplant rejections, we have got hyperacute rejection, acute rejection, chronic rejection. So acute cellular rejection is T lymphocyte mediated. Hence it is cell mediated immunity like your MAN2 test. So type 4. Hyperacute is due to preformed antibodies. So that is basically type 2. Then angiotensin converting enzyme induced angioedema. It is not related to urticaria, but it can occur years after the start of treatment and it can affect head and neck, everything is true. Relative risk is what, doctor? Risk difference or risk ratio? Attributable risk is risk difference. Laparoscopic bariatric surgery, आप देख रहे हैं ना? Every time they are asking, कॉमेड के में भी आया, महाराष्ट्र में भी आया, कल AP PG में भी आएगा. So duodenal switch procedure is most effective. Severe undernutrition, when do you call based on what BMI? Less than 16 is basically called severe. Moderate means 16 to 16.99. Mild means 17 to 18.49. Oh my God, the values are too haphazard. So any of these values can come. Okay. Cachexia is weight loss and muscle wasting. Vitamin E is there in, one more time they asked, sunflower oil. Pulmonary thromboembolism is CT pulmonary angiogram. That way APPG is more easy. 200 questions पूछते 160 skating रहता, 20 questions luck रहता, 20 common sense रहता. Easy. ये 300 पूछेगा और कितने बार he will prove that we didn't prepare for exam thoroughly. So too lengthy paper, right? Ideally 50 questions should be asked and finished. 50 case studies they should give and ask you to, including patient's story, video, physical examination, everything. Only 50 video based questions and decide. Better. Arterial blood gas in case of hyperventilation obviously is respiratory alkalosis. Cryptic tuberculosis is, there are certain definitions. Age more than 60, intermittent low grade fever, unexplained weight loss, hepatosplenomegaly, normal chest x-ray, they all define a cryptic miliary TB. Based on this, the question is created. The most common carcinoma of the thyroid is papillary. Pringle maneuver means when you are operating on the foramen of Winslow, you will apply a pressure to avoid a injury and bleeding from the portal triad. Secondary hemorrhage is 7 to 14 days, sloughing, precipitated by infection, pressure necrosis, etc. Typical tonsillectomy hemorrhages, you must be sure. Complication of a transfusion massively is basically what? Hypothermia, this is also another ill-framed question. Citrate excessively will lead to hypocalcemia. True. Coagulopathy can occur. Hypothermia can occur. Most common नहीं पूछा, complications पूछा, हमको खाली सीधा सीधा दिख रहा है क्वेश्चन. Question frame wrong. Frame is wrong. This is a repeat question, we know that, but he repeated wrongly. What is an absorbable, non-absorbable suture? ये तो पक्का पढ़ के जाना डॉक्टर. Biological synthetic among absorbable, non-absorbable, ये लिस्ट तो मेडिकल शॉप वाले के जैसे पक्का रहना. तो Clostridium tetani, what is the accept? It is a gram positive, not a gram negative organism. Fournier gangrene, both aerobic and anaerobic organisms will lead to a sudden necrotizing gangrene. Poliomyelitis, what is accept? It is enteroviral, it is preventable, vaccination is there. All the three easy statements. Fourth, don't even read it. Answer it. The key to monitor the resuscitation is what? Always urine output. Foley catheter देखते हुए चलना पड़ता acute medical care unit में. Bag में कितना collect हुआ बोल के. Typhoid perforation common in terminal ileum, which has got lot of lymphoid tissue. Hazen's trocar, illogical question. ओपन टेक्निक फॉर क्रिएटिंग ए न्यूमोपेरिटोनियम, एक रैम्बो गन रहता, उसको ट्रोकार यूज करते, उसको बोलते हैं यूनिमैक्स हैजन ट्रोकार, व्हिच इज फॉर ओपन टेक्निक टू क्रिएट ए न्यूमोपेरिटोनियम व्हाइल यू आर डूइंग ए लैप्रोस्कोपिक सर्जरी. दैट इज अ क्वेश्चन. रैमस्टेड इज पाइलोरिक स्टेनोसिस. दिस इज वंस मोर रिपीटेड. गोल्ड होता है 24 आवर मॉनिटरिंग. अगर इस अभी भी आप इसोफेजियल मैनिट्री अपर ये एंडोस्कोपी, कोई आंसर किया क्या? पीछे क्यों देख रहे? यू वांट टू सी दैट ब्यूटीफुल फेस हु आंसर्ड इट रॉन्गली सो दैट they will only ask gold. Every time they ask same question, standard gold standard. बस आंसर रिफ्लेक्सली स्पाइनल कॉर्ड कॉर्ड इक्विना लेवल में आप 24 आवर पीएच बोलना. स्लीव गैस्ट्रेक्टमी इज डन फॉर व्हाट? बैरियाट्रिक सर्जरी इज द टॉपिक ऑफ इंटरेस्ट फॉर एग्जामिनर डॉक्टर, राइट? कॉमन साइट ऑफ एक्सेसरी स्प्लीन होता है हाइलम में रहता मोस्ट कॉमनली. Murphy's sign is basically cholecystitis. Retrocecal is most common appendiceal position. Split thickness graft mein what will you do? Epidermis and part of dermis. So once more, thin split, thick split, full thickness, differences, advantages, disadvantages, सब कुछ पढ़ना है. Nowadays examiner is not asking Parkland formula, but that is also favorite question. First 12 hours में कितना देते हैं everything. Hernia at the site of surgery, purely guesswork, illogical. 10% it depends upon who did the incision. That also is a deciding factor. If I did incision, it is 80%. Maybe you have your own score. Rupture is what? Only a part of the bowel wall herniates. Heller myotomy is an ecclesia cardia. Perforated peptic ulcer, may gas will be under the diaphragm. Difficult question. Kitna percentage, who will know? To know that gas under diaphragm will be there itself is a big deal. Boyer-Harvey is perforation of esophagus. Upper 2/3 is squamous and lower 1/3 is adeno. Conservative Oshner-Sherren is for appendiceal mass. Rao-Singh is, if you palpate in left iliac fossa, there is a aid that will go to the other side and pain in the right iliac fossa will be there. Rectal carcinoma lead to bleeding for rectum as the most common presenting feature. Early. Spurious diarrhea is also found. All of the above, okay. TME is done for, first of all, what is TME? Telemedicine examination. What is TME? Total mesorectal excision. If you know what is TME, you will answer carcinoma rectum easily. Anyway, all of the above is there, no? Second degree hemorrhoid. This is another favorite question, doctor. Prominent blood vessel, no prolapse is grade 1. Grade 2 is prolapse upon bearing down but spontaneous reduction. Prolapse upon bearing down but manual reduction. Remaining is all 4. Barron's banding is used for large grade 1 and grade 2 without external component, such kind of hemorrhoids. Not more than 2 hemorrhoids is what need to be remembered. Intestinal obstruction is all due to adhesion. Thumb printing is an ischemic colitis. Kellogg's triangle has a great importance because gallbladder and cystic artery are closely related. So cholecystectomy it is important to know the Kellogg's triangle. Radio opaque gallstones are 10%. Similarly, kidney stones, what percentage are opaque? Other entrance में क्या पूछा? Salivary stones पूछा. Examiner के हाथ में है हमारा जिंदगी. Salivary stones. Next time think APPG में क्या पूछेगा? Bladder stones. कितने radio opaque हैं? नहीं तो stones can be there anywhere, right? Massive splenic enlargement is a feature of all of them. Sterile pyuria, classical question, renal TB. Matlab pus cells will be there but culture will be negative. That is called as sterile pyuria. Undescended testis will have all these problems. Testicular torsion, malignancy, infertility. Even after you do orchidopexy also you can't prevent seminoma from developing. Lord's operation, Jabulais procedure, they are all for hydrocele. Acute pancreatitis, how many answer alcoholic liver disease? Alcoholic abuse. Sure, you all answered biliary calculi. Okay. 50 to 70% biliary calculi, 25% is alcoholic abuse. So what is your grand score? You are crossing 180, 60%. So if you cross 210, doctor, stop reading. You will get seat. Right? 210 out of 300 आ रहे हैं तो stop reading, enjoy and declare everybody that I am going to be topper. This is not easy paper, madam. Unknown classifications, anonymous names. Huh? No, no, it all depends upon at what level, amoebic level, paramecium level, where, which level is our preparation. ABPG is clinical, but ABPG clinical are easy, supposed to be easy. So, whatever it is, doctor, final story क्या है बोले तो 160 if you cross you will get your dream branch, right? 160 you will cross if at least 130 so called simple questions correctly answered, remaining things 50% answered, crossed 160 line, right? And you know apoptosis, osteomas, bone tumors, endometrial cancers, ovarian cancers, वैसा part calculate कर सकते. So have your list of topics, make it more comprehensive, get ready to face the exam, right? And you are going to get seat. Thank you, doctor.